Yo, it's Mr. Eric, Wednesday, November 17th, 2021. I'm pumped up because I completed my first nursing shift at St. Francis Hospital. It's not what I did yesterday, sitting in the monitor room, but it's actually doing patient care. So let me tell you all about it. I do the typical, I wake up at 5 a.m., get a showering, brush my teeth, get some breakfast in, I make it to the shuttle on time, I make it to the hospital on time, I clock in, that's when I start to get paid, and then I meet my supervisor who's on the unit today. Now, she tells me that my preceptor's out, so she's going to be working with me. They can't give a new grad nurse, well, technically I'm not a new grad nurse, but according to them, I'm a new grad nurse because that's what I told them. They can't give somebody like me, a new grad, 7 patients or 6 patients or whatever, a full assignment to take care of because I don't know what the heck I'm doing, all right? I've never gotten a full patient assignment on my own, especially with my other job because I was still orienting back then. So they can't just give me one right off the bat. I have to be trained up. You got to work your way up from one patient to take care of to a full assignment. I say 7 patients because in this country we're short on nurses. So nurses got to take up a load of crap, a whole bunch of patients to make up for it. Is it safe? Probably not, but people are sick, you know? How are you not going to take care of somebody who's sick? You just got to do it, all right? If you're hired as a nurse, you just got to take care of these people. It may suck, but at the same time, it's like an excuse. If somebody gives you BS about how you're not doing your job right in terms of like documentation, well, you know, you just clap back and say, I'm not able to do it like physically. You know, try taking care of like 7 patients on your own one night and see how much documentation you get done. If you want me to document, yeah, I'll stay 2 hours longer and document, but that's on you to pay me for it. If there's overtime, that's on you. Not sure if I'll ever have that issue. I hope my time management will be good, but we will see. I will let you know. So going back to the whole preceptor thing, my preceptor's not here today, so I have to work directly with my supervisor on doing some patient care. She takes 2 patients, of which I take 1. So I do all my assessments, all my workups, all my research on one patient, and then the other patient that she has, well, she helps me with starting IV lines, getting the pumps working, all that stuff. Unfortunately, I can't talk much about like the patient care I give or whatever because it's a HIPAA violation. YouTube, there's no way I can tell YouTube anything about what I do as a nurse specifically because I'm gonna get arrested or fined or whatever. I cannot talk about patient care that specifically on social media or frankly anywhere because it's like illegal. HIPAA is a legal thing. I'm not gonna risk my license. I'm not gonna go to jail because I'm talking about patient care stuff in these videos. I'm just trying to give an overview of what my life is like. Like, what's the point of going into detail about this certain patient condition when like you could just go into nursing on your own or figure it out or freaking watch Grey's Anatomy if you really want to. But what I can tell you is that I got a pretty easy patient who was on observation and the condition, let me just say, is like diabetes, all right, in general. I just had to watch their sugar intake. I had to do some blood sugars. I had to give some meds. I had to do assessments specific to neurosymptoms with diabetes. So that's all I really did today. I learned some other skills. I accessed the Pyxis. I started a blood transfusion. And most importantly, I did a discharge. I haven't done a discharge before, so it's important for me to learn how to do a discharge. When you discharge a patient, you just got to educate them about where they're going to be going next, like what pills they're going to be taking, who they're going to see in terms of their primary care provider or for a follow-up, and then like other basic education on what you should do if you have diabetes, like inspect your feet, know the signs and symptoms of hypoglycemia when your blood sugar is low and what to do about it. And you want to make sure the patients leave educated on that stuff. That way they're compliant or adherent, whatever you want to call it, so they don't come back, so that they stay healthy. That's all I really want to say. Like, I got 1 patient technically, and I think I did great with 1 patient. Tomorrow I want to work my way up to 2 patients when I go in again. I'll let you know how 2 patients goes. Until then, peace out.